The decision by the U.S. Department of Health and Human Services, HHS, to cancel hundreds of vaccine-related grants has sparked serious concerns among public health experts, raising alarming questions about the future of immunization efforts in the U.S. Researchers, whose work focused on increasing vaccine uptake and understanding vaccine hesitancy, have warned that these cuts could have dire consequences, particularly as vaccine-preventable diseases such as measles and whooping cough are making a resurgence. With the cancellation of roughly 300 vaccine-related grants, many are questioning the logic and long-term ramifications of deprioritizing such vital research at a time when public health is already at risk. The sudden termination of these grants, particularly those aimed at understanding and overcoming vaccine hesitancy, has left many researchers bewildered and frustrated. Dr. Douglas Opel, one of the researchers impacted by the cuts, expressed the grave implications of the move, pointing out that this research was essential in understanding the factors influencing communities' decisions around vaccination. His work, aimed at increasing vaccine confidence in Alaska Native and American Indian communities, was among the projects suddenly discontinued. This is not an isolated case. Many other pediatricians and public health experts are now scrambling to make sense of a policy shift that seems to directly contradict previous public health priorities. The loss of funding for research into vaccine uptake comes at an especially critical moment. A study conducted in 2024 found that 1 in 5 parents in the U.S. were hesitant about vaccinating their children. With outbreaks of vaccine-preventable diseases like measles already being reported, this increase in vaccine hesitancy poses a serious threat to public health. Measles, in particular, is a highly contagious disease that often serves as an early indicator of broader declines in vaccination coverage. Experts worry that without targeted interventions to address vaccine hesitancy, other preventable diseases could follow in its wake, leading to a public health disaster that could have been avoided with the right research. The timing of these cuts could not be worse. The U.S. has just experienced its most severe flu season in over a decade, with hospitalizations and deaths reaching alarming levels. Public health experts have pointed to the drop in flu vaccination rates as a contributing factor to the crisis. At the same time, the cancellation of grants aimed at improving vaccination rates for flu and COVID-19 vaccines for children underscores a troubling pattern of neglect toward preventive measures that could mitigate future outbreaks. The ramifications of these cuts go beyond just the disruption of ongoing studies. Researchers, who had already invested significant time and resources into their projects, now find themselves unable to complete their work. Dr. Melissa Stockwell, a pediatrician whose grant focused on using text reminders to increase flu and COVID-19 vaccination rates for children, described the decision as both devastating and wasteful. Nearly $1 million had already been invested in her research, which is now essentially lost. For Stockwell and many of her colleagues, this abrupt termination not only halts critical public health work, but also represents a larger disregard for the importance of science and data in shaping health policy. The most troubling aspect of these cuts is the broader signal they send about the government's approach to public health research. By deprioritizing science aimed at improving vaccine uptake, the administration risks undermining decades of progress in preventing infectious diseases. Vaccines have long been recognized as one of the most cost-effective public health interventions available, saving billions of dollars in healthcare costs and lost productivity. For the NIH, a key player in supporting this research, to abruptly cut funding for such a proven and essential tool in public health is a deeply concerning development that suggests a shift away from evidence-based policymaking. While the government justifies these cuts as necessary to carefully steward taxpayer dollars, the long-term costs of not investing in vaccine research will likely far outweigh any short-term savings. The failure to support research into vaccine confidence and the effectiveness of outreach strategies not only threatens the health of individuals, but also jeopardizes the collective immunity that protects the most vulnerable members of society. As vaccine-preventable diseases like measles surge once again, the administration's decision to cancel these critical grants could be seen as a reckless gamble with public health. In conclusion, the cancellation of hundreds of vaccine-related grants by HHS is a deeply troubling development that could have serious consequences for the future of public health in the U.S. The cuts signal a disturbing disregard for the importance of vaccine research, particularly at a time when vaccine hesitancy is on the rise and outbreaks of preventable diseases are already occurring. Public health experts warn that the administration's focus on short-term savings at the expense of long-term health outcomes will not only undermine efforts to combat vaccine hesitancy, but could also lead to devastating public health crises in the future. The lives of individuals in the U.S., as well as the health of the nation, are at stake, and the consequences of these decisions could be far-reaching and irreversible.